an exclusive preview, which you'll learn in the 2-day webinar. Each minute of this video is important. Watch attentively.
So I'll be teaching about what is multidimensional module, how to do case taking in such deep irreversible pathology, that what is that which is, how to make totality in such cases, how to select a tool for prescription, a right tool according to that totality. Finally, how to develop follow-up criteria. So once I explain this concept, then we will go to one by one, to each disease. For example, then we go to, let's say, deep pathology.
Right.
So then deep pathology, we will divide them, that we have most of the deep pathology can be divided into degenerative, where the cells are degenerating, whether kidney or heart or lung or brain. Degenerative or proliferative, like autoimmune, where the antibodies or antigens are proliferating, right?
Yes.
Like cancer, where the things are proliferating. Like viral diseases, AIDS, and they are proliferating. Here, there is no degeneration. So definitely in both, slight difference approach will be there. Your totality will be different. Your case taking would be slightly different. You understanding it?
Okay.
Now, when you come to case taking, then in such cases, naturally we are talking about deep pathology. Then one of the area which is very strong is chief complaint. So how you understand the chief complaint in terms of location, sensation, modality, and concomitant. Concomitant means that you look at the way they think, feel, perceive, sense, and react. Dreams, which came with illness but no connection. Same with generals and particulars. So after exploring the chief complaint, you can explore chief complaint in your standard questions which you have. I have like another 50 questions which are artistic questions, where the chief complaint can be explored in an artistic way to bring out more on the surface. Generally, we ask those basic questions, what changes at location, modality, sensation, and concomitant. I have 50 more questions to offer. Like that. So after exploring chief complaint, then explore the original totality. One is the chief complaint, then original totality. And in that also you ask standard questions, artistic question to bring out the whole symptomatology out. Now, once that is done, so that case taking I'll be teaching, then I'll go further, that in where this totality of chief complaint and a totality of the whole is matching, a remedy where both connect would be much better. Making sense?
Absolutely, sir. Absolutely.
So that's what I will take. Then in deep pathology, whether it is proliferative, whether it is degenerative, the posology, we have 3 group of posology, 30 to 10 mm. We have LM1 to LM12, and we have mother tincture to 12C. How to use each one of them according to principle of homeopathy in this kind of cases. So that posology is also individualistic and not just based on disease. The deep pathology means lower posology. Deep pathology means LM. No, we will go scientifically. So that's the second part of it. The third part of it, since we are studying autoimmune disorder, the Hahnemann time and last 200 years, this term was not there.
Yes.
So none of your remedies in Boric and Phatak mention autoimmune disorder, except few.
True. True.
So how do I understand remedies from autoimmune disorder perspective? Do I have remedies mentioned in adaptive immunity? Do I have remedy for macrophages, just macrophages when they got affected, just the blast, mast cell when they are affected? Like that, do I have where only T cell are affected, where the B cell are affected, or a particular mixture of them is affected? Is it mentioned in my book?
No.
So actually, yes, we don't read like, so we have to put it together. So those people who are only looking for therapies, they will directly go there. You understanding? And then they can start from part and then match the whole. So those remedies, at least some of them I will teach if time permits.
Great.
And
Great.
how to read them. So naturally, they'll have their own materia medica of autoimmune disorder, which is missing. Then we will take cases from both perspective, the degenerative perspective and autoimmune perspective. So degenerative perspective, I will start with degenerative as well as the autoimmune. Let's say SLE with lupus nephritis. Okay, which is one of the most, the deeper autoimmune disorder, and
Yes.
kidney involvement. We'll go further only autoimmune, like let's say Sjogren syndrome, where a case where therapeutics, generals, particulars, mind, holistic themes all come together. From the most therapeutic part to the, and with this case, we may even connect those who practice therapeutics, how to take best use of them, and holistic and combine them. So like that. Then we will go, maybe if time permits, some more autoimmune disorder like rheumatoid arthritis cases, where different means the whole case is done, where sometime the whole plus pathology comes together, sometime the whole plus the exact reports come together, like that. So we will check that how they come together. I have also kept some cases where double autoimmune disorder is there. For example, alopecia with vitiligo. Both are
That is very
autoimmune and double.
interesting. Yes.
So how do we handle it? Yeah.
Yeah.
So this is as far as the autoimmune disorder is concerned. Then we will go to what we call the organ transplant. Now in organ transplant, imagine you are taking an organ from outside. And if you are taking an organ from outside, don't you think it will bring the state of that whole person whom they got the organ? And that's why you are giving immunosuppression, no, to suppress the whole organ.
True. True.
So if something from external space is coming up, how do you do case taking in organ transplant cases? Nowadays, so many organ transplant cases are increasing. So the case taking wise, what will happen? Totality wise, what difference will be there? Posology wise, what difference will be there? And once the organ is accepted and homeopathically they are improving, what will happen to that organ? Will that speak about the holistic state of the person? You understand? A lot of question comes up there.
Right.
So then I'll pick up maybe one or two cases, depend on our time. One with a kidney transplant. So that before transplant, what we did, the one who is giving kidney and one who is receiving, what we did with both of them. Then once the kidney is given, what we did. And then once the kidney is accepted, what we did. You understanding it? It'll be interesting to see. Then, if time permits, a case of a very young child with a factor 7 deficiency, which was the first case of liver transplant in such age in India. And after liver transplant, they came and problems with ulcers in the GI tract, a lot of ulcers with the stomach, big ulcers. What happened? How did we deal with such a young child with a transplant? What happened to that child overall? Now that child is 22. So in last 18 years, what happened to that child? You understanding? So that if time permits. Then we will go to Another deep pathological cases, that is coma. Now in coma, what most of the people do is observation. But can we do a holistic case taking here too? And if yes, how to do it? What are the criteria of question we put it so that we will get PQRS not in one area but many areas? And how to observe from disease to investigation reports to mind, and how to make use of the relatives around the time when he went into the coma, the organ which took him to the coma, it can be nephrotic coma or brain coma. So depending upon, so how you do case taking and make best use of that and give a remedy. So that way, in such cases also, you don't depend directly. Coma means either opium or this or that. How you use your principles and you give individualistic remedy. And of course, we will see follow-up there. And last, that pathology in all such cases. Slightly difference will be there. If an organ he is receiving, then which group of we will give and why? You understanding it? If a proliferative is there, which group and why? In same way, if there is a coma, which and why? If with a scientific reason behind it, not just, So this is what I'm planning. So this way that we will be able to understand that not just one book centric, one person centric, one system centric or one therapy centric approach, but we will do kind of integration of that, what we call multi-dimensional. Depending upon patient's individuality and where the symptoms are and what the symptoms are, we'll make the totality, and based on totality, our tool selection from materia to repertory to miasm to disease to themes to kingdom subkingdom, depend what patient put into center, we will select that. So that way it will be individualistic. And all the follow-ups, what we will do is at least minimum 1 year follow to 10 to 15 years follow.
Right.
That way the conviction will be there that whether the person who is attending is from a classical homeopathy or therapeutic homeopathy, or whether just believing in the sensation method or any other school, they'll understand it better and they'll take both together. Like that's my whole aim.